Good morning. I just wanted to say hello and to show you a quick tool that you can find in your kitchen to aid in some tissue recovery if you maybe have gotten an injury or you've had a really tight spot that you just can't stretch out. This little guy is really helpful, and all it is a fuzz spoon. So I'm gonna flip the camera around to kind of point down to show you with myself, I'm getting over an injury myself, how I use it and how you can use it too, okay? Okay, so we've got our fuzz spoon, and the area that I'm gonna work on is actually this area right through here. Make sure I'm in focus here. This area right through here in this big thumb muscle. I got a new tool at work and managed to work harder instead of smarter, and I kind of over bent my wrist, and this area through here has just been very inflamed and very angry and very tight. And so I'm finally starting to feel better. It's consistently not feeling inflamed anymore. It's not popping or cracking. I was getting really painful pops in there. So the inflammation is starting to leave. We're out of the acute stage. I'm moving on to from ice, which is really what's appropriate for that really inflamed, painful stage. And now I'm moving on to heat and soft tissue work to really get blood flow and get those tissues really healing. So I'm gonna I've got a little bit of lubrication here. You can use olive oil, you can use avocado oil, you can use anything that's gonna help you glide on your skin. I just happen to have massage lotion. And as I'm doing this, I'm just kind of feeling for where I'm feeling tightness through here. Whew, I feel like a guitar string running this way. I'm just kind of gently finding the areas that I want to put my attention on, right? Through here has been really sore. Just paying attention with what I'm feeling right in there feels a little trapped. And I was noticing through my wrist, and this is probably from the position I've been in forever, right through here, as I go through here, it feels like this band of really taut, like wrapping. And if I go this way, it almost feels like bubble wrap. So I think I've got the connective tissue is sticking together. It's formed like a pattern from me being in like a position. So I'm gonna actually treat this a little bit too. And that's just basically when you feel that bubble wrappy, like stuck, that's like scar tissue, adhesions, things that are like gluing together. When you're kind of stuck in a position for a long time, the connective tissue like to suck in together and get stuck. And so the fuzz spoon is basically, we're going to use the edges of the fuzz spoon, okay? And I'm going to start here, and you can do it however you want. I'm just going to slide across, and I can really feel crinkle, 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 crinkle. And I'm just gonna give some friction. And right now I'm going with the muscle tissue. So the fibers run this way. So I'm gonna go stick with the tissue fibers, and I'm really not pushing hard. I'm just doing it really gently. I'm just warming things up right now. And you can see that red mark is starting to show. It's getting some heat. If it really starts to show, that's my dog barking at the chickens. You can also call these Shaw marks in Chinese medicine. It's kind of, I find that they show up on the areas that are really adhered and stuck as you're trying to break them up. And, you know, as the comfort level starts to warm up and the tissues start to soften and it feels more and more comfortable, it's not so grating, I'm going to start pushing harder. And always do it to your comfort level. So this is just breaking up the tissue. And then I'm going to do a little cross too, because that's gonna, you think of scar tissue as like pickup sticks, right? And when they drop, they kind of crisscross and go all over the place. And this cross fiber action basically realigns the tissues and allows them, because when they're crisscross, they don't have elasticity. When they line up, then they have elasticity again. So that should help. So now I'm just gonna start moving as I feel like I need to move. come down this way a little bit. This area has been very, very poppy and sore. Ooh, it's very grindy right there. I'm gonna hang out there for a second. So you're just searching, really. When you feel the texture change, hang out. I'm gonna go this way first. I'm almost pretending like it's an ice cream scoop at times too. Like right now I'm kind of visualizing scooping the tissues, and I'm getting really grindy. And the other day when I did this, I started going cross fiber and I went kerclunk, kerclunk. And once I kind of did that for a while, my thumb started to feel a lot better. So I think there was just a really upset, strained right there. Oh yeah, you can almost see that happen right there. I don't know if you can see that. This is a spot that I find on people that use their hands a lot. This is something you can do, if especially like massage therapists, chiropractors, dentists, dental assistants, bakers. They're always in that pinch grip. This is really helpful for those people. Get up along here because there's attachments through here. Oh, that feels really good. You can almost hear a clink, right? That's that connective tissue kind of clunking. And I'm just doing it to my comfort level. As the tissue's warm and soften, I can go deeper. And I get in here too. So yeah, give it a try. Make sure that, you know, you're not doing it if you're in like acute active pain where you've just injured yourself. I'm gonna actually flip this around now. Yeah, so if you're still in like the icing stage of your injury and it's really painful still, you need, or maybe you're having to wear a brace to support it, you're having to take ibuprofen, that's really an acute inflammation stage. And your body is reacting normally. And really, if you're in a lot of pain, you don't want to be, you want to give the tissues time to heal. And that's kind of what your body's sort of trying to do, right? It's trying to send blood flow to the area to heal whatever injury you've got. You just want to let it do it. If it's really painful, really the only thing that's indicated right now is ice. As things start to calm down, you find maybe I don't have to wear the brace as often. Maybe I'm not having to ice as often. Maybe I'm starting to like move it around. It feels stiff, but it's not so painful anymore. Then we're kind of in that subacute phase where you can kind of start to do some ice massage, maybe rotate some heat if it feels good. Heat is going to bring blood flow to the area. And then really you don't want to do like massage like I was doing until you're kind of like through that inflammation, all that inflammation stage, because that's just really gonna you don't want to re-injure the tissue. You want to break up the connective tissue that's kind of stuck together. The more you massage, the more inflammation is gonna, like, it's gonna draw blood to the area, which in turn makes it hurt more. It's healing, but it hurts more with heat. So just stick with your comfort level. If it hurts, don't do it. But this right now, I'm at the point where it feels good and it helps it feel better. So that's where I'm at, and just stick with that, whatever feels good. So yeah, I hope that was helpful. And I can find a fuss spoon at a grocery store. So I wanted to give you a tool that's really, really easily accessible. So yeah, enjoy, give it a try, and I'll talk to you guys later. Bye.